Hi everyone, welcome back to my channel. My name is Yana. For those of you who are new here, I'm a nursing student. I'm finishing a Bachelor of Nursing Science this year to become RN. And at the moment I'm holding license of EN because I've done Diploma of Enrolled Nursing at TAFE. So if you've been here for a while, for those of you who are not new, you probably have seen me making videos about my studies at TAFE and then my transition to uni, and sharing my experience. So in today's video, I decided to make sort of like let's talk video where I would be answering some of the questions that you guys ask. And for today's question, I picked the most common one that, believe it or not, many of you actually ask, and many of you shy to ask because it's such a delicate matter that not many people want to discuss this online or on public, not to hurt anyone's feelings, and just the way some people feel about it, whether you're in a position of a patient or you are in a position of a nurse or a carer. Okay, so I'm going to read the last comment on this question that I've been asked by one of the subscribers to my channel. I believe, answered this question a few times in the comments before, but I understand many of you are busy and I have hundreds of comments under my videos. Not many of you will be going and reading it to find the answers. So I thought I'll just bring it out as a video, so maybe more of you could be able to see it. Okay, so the question sounds like that. So the person said, thank you for your videos. I'm dreading this side of nursing. I have a weak stomach when it comes to changing, washing a patient. How do you overcome this? I can handle blood and open wounds, but not this side of things. Okay, so many of my friends actually, in real life, not on YouTube, but my actual friends, ask me this question so many times as well, because I inspired a lot of people to go and study nursing, like in a good way. It's something that they wanted to do and they're really happy at this stage now. Those who are almost already finishing their diploma in nursing at TAFE, and those who went to uni, they really like their studies. But before going to do that, they were asking me the same thing. How can I deal with washing the patient, cleaning the feces, urine, bodily fluids like a vomit, for example, discharge from the wounds and things like that, because it is hard. It is very hard. Not many people want to talk about it online. And the reason why I decided to bring this topic online, because I think it's very important for many of you, as I can see how many of you asking this question. And also other thing is that it's just the nature of us that it's hard to deal with certain smells when you care for people. And not to talk about it, that means that could put frustration as, and also a stop point for those people who would want to do nursing, but then think, okay, like I can't stand the smell of someone else, and see the feces, and all of that. I don't think I will be a good nurse. I don't think I will be a good carer or AAN, because how am I going to stand all of that when I look after people without showing my how to say it, not the discussion, but like showing, not to show it on my face, gestures, for example, like scrunching my face if I don't like the smell, or leaving the room or things like that, because the last thing you want to do is to make your patient feel uncomfortable when you do their cares, you know what I mean? So the person asked me if I can share my experience, how I overcome this, because I've been working now in healthcare almost for 3 years, because I started after first semester of my Diploma of Enrolled Nursing, basically after finishing my first placement. So it's been almost like, in this December, it's going to be 3 years me working in healthcare. And trust me, I'm not a person who like have a complete resistance to someone else's bodily fluids, you know, its look and smell. I've been there, you know, it's been really hard for me, to the point when I had 2 times in my memory I needed to leave the room. Okay, because I could not smell or stand the smell of urine of someone. It was one person who had UTI and another person was really dehydrated, and sometimes it can cause really profound smell, which like it was giving me to the point like it was almost giving me a headache and was giving me a feeling of vomiting. And the last thing I wanted for my patient to see me struggling, because it's already uncomfortable for them to be in a position like that when they need to be cared for, and they don't want us to show that we feel sort of like unable to handle it or feel disgusted by the smell, you know, and things like that. But I needed to leave the room because I was not feeling well, and I was feeling unwell to the point that I didn't want to like vomit in the room, you know, so I needed to leave. Okay, but my advice to you, okay, how to overcome it, like first of all, you have to understand, or you need to try to understand. I don't want to say like you have to, because you can't just make someone to do something that they don't want. So I think me saying you have to would be a little bit harsh. So I want to rephrase it and say like, try to understand that people who are in your care, they are vulnerable patients, vulnerable people, to the point that when they have certain sicknesses, if you work in a hospital, let's say as an AN or as a nurse, you know, they come with different conditions. Most of the time, it's not their choice to be sick, you know, and not being able to care for themselves. So they have no choice but to accept your cares, so that could become more better, so they could bring their health back, and so they could maintain their daily life activities, like being showered, being able to go to toilet, you know, if they can't get out of the bed, being able to be clean, so you could change their continent aids, you know, or their bed sheets if it got soiled and things like that. You know, if someone came out from the surgery, they've been under general anesthesia, they might come out, you know, and vomit when they, you know, like feel like they are nauseous, you know, because one of the side effects of the anesthesia is that people feeling nauseous, you know, they can vomit. So at times you will need to deal with those situations, and understanding that people feel vulnerable when they are sick can help you to just understand them better. Understand that what they're going through is not their choice. They really, really rely on your help. They would expect you to show respect to them, you know, and compassion, you know, when you do their cares. The last thing they would want to see you crunching your face, you know, turning your face away from the smell, you know, or like it happened to me, left the room. That happened in an aged care facility, not in a hospital, you know, and things like that. They already feel vulnerable, they already feel uncomfortable, they feel shame at some point, because some people don't want to be exposed naked, for example, when you do their cares. Some people, for that matter, would ask only a female person to come and do them if they are female. You know, if they are men, they would just say, I would want a male nurse to come and do my cares because I feel shy in front of the female, you know, when they do my cares and things like that. So just try to put yourself into their shoes, you know, and try to feel how they would feel, because as I said previously in one of my videos, like, you never know what can happen to you. We all might end up in a hospital, whether we got sick, whether we've got maybe some sort of an accident, you know, we can't get out of the bed, you know, we have really serious injuries and things like that. And then when we have nurses to come and look after us and care after us, we would want to have and receive respectful treatment. You know what I mean? Someone who understands us, someone who understands the situation that we are in, you know, who can show support, sincerity and all of that, you know, and not opposite. I understand that theoretically it is easy to think like that and say that, but in practical, when you go and you do the cares, you feel like, oh my god, I can't stand it, it smells too bad, you know, I had enough, I feel like I'm going to vomit. Okay, the other thing I want to tell you that with time, when you already have this mindset, when you feel that way in terms of approach to a patient, okay, with time, when you care for people more and more, you will become resilient to the smells, believe it or not. Like, I can walk now into a room where someone maybe like had open bowels, you know, and the person is bounded to bed, you know, yes, it does smell, but to me it wouldn't smell as bad as if on the first months is when I just started my career in healthcare, you know. So your body does become resilient at some point, you know, or resistant, whatever you call it, to the smells. You're not going to be reacting to it as much as in the beginning. And that's true, like, this is true. It's not just my opinion, like, I work with so many different professionals and they can say the same thing, you know. The only thing that is really hard for me still, and I'm not gonna lie, it's sputum. Like, if someone, you know, have certain conditions with lungs, you know, and they have a lot of mucus building up there and they have to spit it out, especially people who've been smoking for many years, like, I can't look at sputum. Like, I can't. I just feel like I'm gonna lose it. Yeah, so that's the only thing that I still feel like very hard for me to deal with it. But because I don't come across this very often, I guess I didn't develop that resilience to it yet. You know, if you would be working somewhere in a ward where people would be coming with respiratory conditions, you know, like asthmatics, COPD, you know, when they have a lot of mucus there, you know, and things like that, smokers, you know, who have maybe cancer, things like that, you probably would develop that resilience, but I don't work in that ward. So for me, like, seeing this only sometimes, like, I see it in my aged care, just, you know, a few residents can do that, you know, I still feel like it's really hard for me. I don't have it to the point where I would be vomiting, but if I stare at it for too long, I probably would, I guess. But if I need to move the cup or something, I'm just like, take it, you know, and just move it. But I don't show it to the resident that I'm disgusted or something like that. I would just quietly take it, not just stare inside, take it, move it, you know, do my cares, that's it, done. You know, like, I never show to my patients when I practice in a hospital or to my residents in an aged care facility where I work, that I'm disgusted by certain bodily fluids that they produce, you know. I never do that. Okay, so that's the second point. The third point, if you really feel like in the beginning that you can't deal with it, okay, in the hospitals they have small like air sprays, air freshener sprays or whatever, like you probably have seen it when you go in your clinical practice. It's like small bottles, maybe this size, you know, and one spray is enough to refresh the whole room. So if you want, you can take that. Most of the hospitals would have them in the bathrooms, in the, you know, in the rooms. So you can take that to the bed of the patient where you're going to care for, like if you know that you need to change the continent aid, you know, and like you can't stand the smell, you know, just take that little thing with you, you know, and just do a few sprays. You don't have to show it to the patient like in front of their face that you're spraying, but you just like, you know, like behind their head or something, just quick spray here and there, that's it, done. The room, like the place, the bed space where you close the curtains, you know, already will smell nicer. And that would be not just to the patient but also to the other people, because curtains can't block the smell. And if you are in a public hospital, there are people who share the room, like 4 people, 4 beds sharing the room. Even in the private hospitals, there are rooms where people share the room together. It could be 2 patients, could be 4 patients, you know. So I do really often as well. When I finish care, sometimes I can spray a little bit the space, because when you open the curtains, be respectful and mindful to the other people who share in the room, so they could, you know, have nicer smell in the room, because they can't leave because they're either bedbounded or they have a conditions that, you know, they can't be walking somewhere and sitting and waiting for the smell to go away. So that's normal. In aged care facility, my aged care facility where I work don't provide any air fresheners, which would be really nice if they do, but we have 120 beds, and providing air fresheners to each bedroom or to each room of each resident, it would probably never happen. If you want, for your own comfort, you can go and buy a small air freshener spray and just keep it in your nursing bag or in your pocket of your nursing pants, you know, and just keep it with you anytime you do cares, you know, and just spray it. Like, I've done this many times when I needed to spray the room. I never had any complaint from a resident saying, oh, please don't spray. Like, just be mindful if someone is asthmatic, which doesn't happen really often, but if you have someone that is asthmatic, you know, just make sure that the spray is not flaring their asthma, you know, and they feel comfortable. But trust me, like, nobody would tell you that, oh, please don't spray my room. Like, everyone likes fresh smells and things like that. Also, the other point that a lot of women, especially women in aged care facility who are residents, they love to decorate the rooms, they love to have candles, they love to have aroma sticks, you know, and all of that. So I have a lot of residents in my aged care facility where I work. When you enter the room, from the aroma sticks and all this, how do you call it? Oil diffusers and stuff, their rooms smell really nice. So even if they go to toilet, even if you need to change them, usually their children, not themselves, not the residents themselves, sometimes they have like some impairments in terms of dementia, stuff like that, you know, their families bring those things and they put it in their room so it could smell nice, because first of all, they do care about them, secondly, they come and visit and sit in their room and they want to smell nice smell as well, so they do care about these points. So that just helps as well. When you do someone else's cares in a room, the room smells nice. So like, in a real world is not that bad, really that bad, but yeah. Also, I'm not gonna lie, you will have situations when your residents, due to dementia, you know, they don't know what they're doing anymore. They can't really distinguish between what is feces and what's other substances they can hold in their hands. But they can come out sometimes to you, like, you know, with their hands dirty because they play, you know, or they can come just like and bring you something in their hand, like, what should I do with it and stuff like that. When someone has dementia, you can't blame them from not understanding what is what anymore in their life, you know. So you might have situations when you need to like do the whole body clean, the whole body wash and things like that. It is difficult. Okay, guys, it is difficult, but as I said, with time you will become resilient to that. And if you can help yourself with the sprays, okay? Carrying a small spray can make a huge difference when you clean someone. Trust me. Such a simple thing, like really such a simple thing can make a huge difference. But yeah, so that's all what I wanted to say to you. Like, I don't think it's really something that is really difficult to overcome, because there are many people working in healthcare industry, whether you are AN, whether you are a carer, whether you are a nurse, like we all care about patients, okay? In the hospital, even if you are RN, you will have situations when you will need to change the continent aid of your patient. You will have situations when you will need to change a dressing that would be oozing. You will have people who would be vomiting. You will need to do a IDC cleaning, IDC emptying, you know, and some people can have very profound smell of urine. That could be due to dehydration, due to bacterial infections, you know, UTIs and things like that, kidney problems. That could be due to certain medication intake, because some medications can make your urine smell quite strong, you know, so you will be dealing with something like that. Some people say like, oh, okay, well, AAN do the most dirty job, you know, like roughly speaking, you know, carers do the most, you know, like dirty job and stuff like that, but then RNs, if you become RN, you never clean anyone. That's not true. Like, we all do cleaning of the patients, because this is something that a part of cares that we provide as nurses. You know, like when I do my clinical rotations as RN at different hospitals, I do clean my patients. I do, you know. So it's not like you have AAN always or warranty on the floor, they can do all of that to you. There are times when you don't have AAN, especially if it's a PM shift, you know. So you have to do the cares by yourself. So I think this is all what I wanted to say in this regards. If you have more questions, you can ask me under this video, but I try to be quite honest, yet still showing respect to the people that we care for, because as I said, any of us can be in that situation one day, and the last thing we want to see is just disgraceful treatment from a healthcare professional towards us, because we're all human and we have to be caring and sincere to each other, you know, whether you work in healthcare or any other field. Because in my opinion, this is how things should be in this world. So yeah, if you have more questions, just place them under this video and I'll try to answer them. And I do have more questions that you guys frequently ask. I'll try to bring them in a different videos, because I think it would be easier for you to find it. Also, what I wanted to say in the end, if you do have Netflix, watch The Good Doctor. I'm watching now the first season. It's amazing show. You actually can see there this the way they care for their patients. This show is from the perspective of doctor-patient relationship, not the nurse, but yet we all work as a team, right? It doesn't matter whether you're a nurse or whether you're a doctor, we all work as a team, and we all have to show the same sort of treatment and compassion to our patients. Just watch the show. They show, they're really, really good, how doctors show compassion and sincerity and care and understanding towards their patient, how they work in a team all together and finding the best solution, how they can help to people. This show, in my opinion, is so inspiring to every healthcare professional out there, just reminding us that humanity is very important these days, just to be a good and kind human being to others. And healthcare field is a field where you can practice this fully, because we deal person to person, you know, like it's a close contact. And yeah, so definitely watch The Good Doctor. I love it. I'm almost finished the first season. I can't wait when I start the second one. And yeah, you will find a lot of inspiration there, because they also show with how many things they deal there, you know, in terms of things that our body produce, you know. And yeah, so anyways, thank you for watching this video. I hope it was helpful for you, and I'll see you in my next ones. Bye.